Hello and welcome to the Tri-Cities Diabetes Coalition first annual virtual health fair. My name is Juan Ramirez and I am the co-chair for the coalition. Every year, the Diabetes Coalition comes together to host an in-person health fair. However, as we continue to live through this COVID-19 pandemic, we had to change things up and get a bit more creative to carry on with the coalition's mission. I'm happy to introduce to you today our chair for the coalition, Sandy Quiroga, who will share our mission and lead us through today's agenda. Please meet Sandy.
Thank you, Juan. My name is Sandy Quiroga, and I am the chair for the Tri-Cities Diabetes Coalition. Every year, the Diabetes Coalition comes together to host an annual in-person fair. During those fairs, community members have an opportunity to come and receive complimentary health screenings such as blood pressure checks, foot screenings, but most importantly, glucose checkups. However, just like Juan said, we had to change things a bit up this year so that we could carry on with the coalition's mission, which is to implement diabetes education and awareness in our communities, even if it meant going through the virtual world. So we hope that you enjoy today's event and take back useful information for yourselves, your clients, or your loved ones. A quick overview on today's program will include a message from our community's public health officer, Dr. Amy Person. We will hear from our keynote speaker on today's related topic of healthy habits during COVID-19. Afterwards, make sure you are ready because our community partners come fully equipped with all the best offerings, which makes each one of their organizations unique in regards to services and amenities they offer our local community members. So let's begin. Today, I am pleased to introduce to you our Public Health Officer, Dr. Amy Person. Dr. Person has served Benton-Franklin Health District as the health officer since October of 2011. She has a Doctor of Medicine degree from the University of Illinois College of Medicine, a master's degree in healthcare informatics, and a certificate in geographic information systems from University of Wisconsin. She is a board-certified provider in pediatrics, and prior to joining Benton-Franklin Health District, Dr. Person provided clinical pediatric care in Milwaukee, Wisconsin for 18 years, primarily addressing the health needs of underserved adolescents and children. Dr. Person serves on the boards of several state and local community organizations. Please help me in welcoming today Dr. Person.
Thank you, Sandy. And thank you, everyone, for joining our virtual conference. This year, more than ever, diabetes prevention and diabetes treatment is important. Conditions like diabetes make COVID-19 more serious, and people who have diabetes are more likely to experience complications. So getting your sugars under control if you have diabetes, or finding out early if you're at risk for diabetes is important to keep yourself healthy from diabetes, but also healthy from COVID. I hope that you will glean a lot of useful information from our presenters. One of the things we've learned from COVID-19 is that groups that are often more susceptible to COVID are the same groups that may suffer more from other chronic diseases. This includes our Hispanic population, also includes Blacks, as well as other persons of color. So getting support from the community is important to help you combat not just diabetes, but also to combat COVID. So we hope that this information is going to be useful. We know in Benton and Franklin counties, nearly 1 in 12 people has diabetes. The number of people that are at risk for diabetes is much higher. Obesity is one of the leading risk factors for diabetes, and unfortunately in our counties, nearly a third of adults are obese. Obesity also puts you at higher risk for COVID-19, so that's just another good reason to try to get that condition under control as well. At the Benton-Franklin Health District, we have been working to help address COVID-19. Because we're interested in the entire health of the community, we also support all missions to reduce chronic disease in our community, including the very important work of the Tri-Cities Diabetes Coalition. So I hope everyone will take a moment to listen to the opportunities that are available in our community. And after they're done, I hope everyone remembers to keep their masks on, to keep their distance. And this year, please get your flu shot as well. So thank you very much.
Thank you, Dr. Person. And as a reminder, like she just said, make sure you are all practicing those safety regulations out in the community to keep yourselves and your loved ones safe. And don't forget to get your flu shot. Very important this year. Thank you, Dr. Person. So as you all know, we've all been affected in one way or another during this pandemic, or better known as COVID-19. For most of us, it meant extended stay-at-home orders, closure of public parks or hiking trails, which if you're like me that enjoys being outdoors, it meant trying to adapt to a healthy routine while indoors at all times. Today, I have the pleasure of introducing a motivated woman doing amazing things to raise awareness and have a better understanding on how one can improve their health and proper nutrition. Please help me welcome Karen Del Rio. Karen Del Rio graduated from the Master's in Leadership Studies at the University of Texas at El Paso, also known as UTEP. She holds a bachelor's degree in health promotion with minors in community health and nutrition. She works as a health educator at Sun City Dietitians, where she leads the diabetes prevention program as a certified diabetes prevention program lifestyle coach. Karen has experience as a research coordinator at the Center for Interdisciplinary Health Research and Evaluation at the University of Texas at El Paso. She has coordinated and organized health promotion and philanthropy events in the community and at UTEP. She is involved in multiple health organizations. However, she is widely known for her contributions as founder and president of the Health Promotion Student Association and serves as a collegiate champion for SOFI. I would like to introduce to you today Karen Del Rio, who will be speaking on healthy habits during COVID-19. Welcome, Karen.
Hello, thank you for such a warm introduction. Again, my name is Karen Del Rio, and I would like to start by saying thank you to Tri-Cities Diabetes Coalition and the Yakima Valley Farm Workers Clinic. Today, we're going to talk about healthy habits during COVID. At the beginning, we're going to start talking a little bit about the impact of COVID in people with diabetes, and then we are going to talk about our healthy habits. If you're living with diabetes, you are not more likely to get COVID than the general population. However, COVID can cause more severe symptoms and complications in some people living with diabetes. For that reason, it is extremely important that you follow your local regulations, wash your hands, and avoid contact with other people by staying at home. We can help ourselves and help each other. Some of the symptoms that we should be watching out for are fever, dry cough, shortness of breath, and if you feel that you are developing symptoms, please call your doctor. When you call, if you have your glucose readings and your ketones readings available, feel free to share that with your doctor. Also, be clear on your symptoms and ask questions on how to manage your diabetes. Now, many people are able to live well with diabetes thanks to a combination of medication, health education, a healthy diet, and exercise. So today we're going to be reviewing a little information on healthy eating, medication, exercise, monitoring our glucose levels, and how we can manage our stress. We're going to start with healthy eating, especially because now that we are spending a lot of time at home, the fridge made it seem closer than ever. This can make it very difficult to keep our regular snack schedule. So for that reason, I would like to share with you the zero carb snacks options. And here are just only some options. The key here is to include protein because when we eat protein, we will tend to be fuller for a long time. Of course, ask your dietitian. And here are some options. So we can have a hard-boiled egg. We can have a tuna and lettuce wrap, olives, nuts, ham and cheese roll-ups. Also, we can have the low-carb snacks. And here is the list. Something that we can try is peanut butter and celery, carrot sticks and hummus, Greek yogurt, cucumber, and a ranch dip. Remember that if you're interested on this list, you can find that list on our website or on our Facebook page under the name of Sun City Dietitians. Okay, moving on, medications. And why medications are necessary? Well, if you're living with diabetes, your body is producing less insulin. So if you take your medicine, you're helping your body to produce more insulin. In case you have to take insulin, also you're taking your body managing glucose. So if you are like me and you sometimes forget to take your medicine, set an alarm on your phone or tell your spouse that kind of remind you, like, mi vida, please take your medication. Now we are going to talk about the importance of monitoring our glucose levels. Monitoring, even though is a hard part because we don't like the poking part, that will help you a lot in reaching your target goals for your glucose levels. Also, monitoring can help you prevent extreme high or low glucose levels. Also, monitoring can help you learn how food and physical activity affect your glucose levels. Also can help you know the right amount of insulin that you will need. And lastly, monitoring can help your health provider determine if you need any adjustment on your dose. Now we are going to talk about exercise. So yes, this time is a little bit difficult because we are a little restricted in terms of movement. For instance, we are facing lockdowns and quarantine, but don't worry, we can do it at home and that can be very effective as well. Something very important about regular exercise is that can increase our insulin sensitivity. And that means that your blood sugar is allowed to enter to your muscle cells and provide you with energy instead of causing a high blood sugar level. Also, regular exercise increases the ability of your muscles to store and use sugar for energy, which is awesome. And scientists have found that weight training can lead to a better glucose control and also lower the risk of complications for people with diabetes. So some tips is try to exercise, let's say 5 minutes in the morning and 10 in the evening. Now with all the technology, we can find fitness videos everywhere, from yoga, tai chi, pilates, zumba. Find something that you really enjoy doing and try to do it at least 3 times per week. But remember to stay hydrated, pay close attention to your blood sugar levels before, during, and after physical activity. Moving on, we are going to talk about how can we manage our stress. So we are being forced in a way to stay inside with limited social contact. And sometimes our mind can act unpredictably, and we have to manage that situation in a way. So the problem with stress, anxiety, depression is that can affect our thinking and also can affect our behavior in ways in which can affect our way of living. Remember that stress is a body's response to help you survive in a situation that needs immediate action. So some symptoms can be headaches, trouble sleeping, fatigue, high blood pressure, excessive sweating, or hair loss. Also, stress can include some emotional and mental symptoms that can be anxiety, anger, depression, frustration, or overreaction to everyday problems. So, what can we do? So, we can either reduce the stressors in our life or reducing the stress response. But how can we do that? So one option can be engage again in physical activity because that will lower the production of the stress hormones and also that will help us sleep better. A healthy diet is a must as well. Get enough sleep. Also, it is very important to reach out to your support system. Call your friends, call your family. Now we have all this FaceTime and we can call them at any time. So if you feel that you're missing your friends, your family, remember that you are just a call away. Also, it is important to take a break because now that we are at home, we have everything together. We can have work and kids and family and everything together, and we don't have a specific space for work, let's say. So now it is important to just breathe and take a break. Some techniques that we can practice as well are deep breathing, meditation, yoga, spirituality. One of my favorites is breathing because breathing exercises are highly effective and they can help us improve our mental health and also help us minimizing anxiety. So some benefits of deep breathing exercises are that they can help you relax and focus more. They are proven to help you reduce the stress levels. They are also, they increase your control of emotions and they can help you sleep better at night. So remember, just as a quick conclusion, to stay healthy and try to practice healthy eating. Don't forget your meds, monitor your glucose levels, exercise at home, and try to relax and breathe. Remember that all this information is available on our social media platforms. You can find us on Facebook, Instagram, LinkedIn, and on our webpage under Sun City Dietitians, and our website is suncitydietitians.com. Thank you so much for your attention and have a wonderful day. Bye.
Thank you, Karen, for sending your support all the way from El Paso, Texas. Just a reminder that no matter where we are or where we go, the focus to bring awareness on diabetes stands in everyone's community nationwide. Thank you again for presenting and sharing how each one of us can stay healthy during this time of COVID-19. So every month, our community partners come together to share and discuss ideas on how each one can support the coalition's mission while out in the community. I welcome all of them here today so they have an opportunity to share with you great information on behalf of each of their organizations. I would like to introduce all of them to you in following order. Please help me welcome Joyce Newsom, representing 211 today.
Thank you, Sandy. So I'm very happy to be part of this important virtual event today. Health is so important to all of us in our communities. So I'm here to talk about the free National Confidential Community Service telephone line, 3 digits, 211. And that number is your one-stop connection to local services and resources that you may need in the town that you live. You can request information on resources such as food, utility, and housing assistance, healthcare, and transportation resources so that you can get to those important non-emergency medical appointments, and so much more. Now, please note, when you call us at 211, we can determine if you're eligible for the food stamp program. As we know, nutritious food is so important for our health, especially when we're managing diabetes. If you are eligible, we will complete and submit the application on your behalf to DSHS. We also have transportation specialists available personally to work with you to help you access programs that can assist with financial expenses when it comes to your transportation needs. Our 211 staff members are bilingual in English and Spanish, and they also utilize a translation line with over 200 languages to assist you and your family members in helping you find the resources that you need. So, in summary, please dial that 3-digit 211 number on your phone and get connected to those resources that you or your family may need. We are open Monday to Friday, 8 to 5 p.m. Thank you and have a good day.
Thank you, Joyce, for providing us today with all that information that 211 has to offer all communities nationwide. Thank you so much. Now, please help me welcome Cheri Snowhite with AMERIGROUP of Washington.
My name is Cheri Snowhite, and I'm the Community Relations Rep for the Greater Columbia region. I'm also a certified health coach and graduated in 2015, so prevention is really important to me. Today's Veterans Day, and I just wanted to say this is a perfect day to honor our veterans and our community while we move forward for those who are suffering with prediabetes and diabetes. I also wanted to thank Dr. Amy Pearson and one of our past Benton-Franklin Health District representatives, Lisa, who have put many, many hours helping those struggling with this debilitating disease by providing education and diabetes resources in our community. And I also wanted to thank Juan and Sandy for putting our very first virtual health fair together. Just a bit about AmeriGroup. We've really been serving the community as a whole since 1984, but we opened our corporate office in 2012, and we have just grown exponentially, and we are in 39 counties now. And I really believe the reason why we've rapidly grown over the short years is because we really do exemplify a whole person care. And let me give you a few examples. I did want to go a little bit into disease prevention. Diabetes and metabolic disease syndrome is at its all-time high. And per the CDC, the prevalence of obesity in U.S. adults increased steadily since 1990, and it's at epidemic proportions. So it's really, really important for us to look at our diet, our exercise, and our lifestyle habits. And I think all these community resources will be a great help to you. One of the things that we've done as of last year is we launched our WW program, which is also formerly known as Weight Watchers. And I think that is a great tool for us to use and a way to inspire you to eat a little bit healthier. Transportation has become one of the biggest needs, especially since COVID. And so last year we had offered a $50 gas cards to our members, but we just wanted to step it up a little by listening to what you needed. And there's a lot of people that don't have cars. So we have also now provided either a gas card or an Uber voucher or a Lyft card, $50 per person per member. Food insecurities is also really big since COVID-19. And Dr. Hippolyte, our very own doctor, had put together a little voucher starting in 2020, the beginning of 2020. And it's a gold card for Costco. So those members that really would like to buy discounted products and food, just know that we're here for you. And we now have vouchers for Costco cards. Mental health plays a really big role in your health as well. Like the dietitian was saying earlier, really does stress reduction and all of that play into our cortisol levels. So just know that we're there for you. And we've offered the mental health resource called My Strength. And that's an app you can use on the fly on any of your smart devices. And they're very helpful. I tried it myself for about a year and I loved it. Education is a huge factor in how we feel about ourselves and our health as well. So we wanted to make sure that we covered that, and we now offer our GEDs for all 4 of the tests that they have. And so in summary, I just wanted to say that we're here for you, and AmeriGroup loves you. And if you need to get hold of me, you can reach me here locally at 509-221-8105. But that information will be provided for you at the end of this virtual tour. Thank you very much, you guys.
Thank you, Cheri, for providing us with an abundance of information with AmeriGroup of Washington. Please welcome Blanche Barajas, representing Community Health Plan of Washington. Welcome, Blanche.
Hello, everyone. I am Blanche Barajas with Community Health Plan of Washington, and I cover the Greater Columbia region. Today, I'm here to talk to you about some of the benefits that we currently offer at CHPW. So CHPW is one of the Apple Health Medicaid programs, and we also offer Medicare benefits. As of January 1st, we will re-enter into the North South Central region. And let me tell you a little bit about our benefits. So for Apple Health or our Medicaid recipients, we do have some enhanced benefits, which include now glasses for adults. So our adults, there's no limit, and you do have access to purchase glasses, the hardware. Some of the other benefits that I would like to talk to you about is the Children's First Rewards Program and the Prenatal Program. Children's First Program is a reward program for every child to receive a gift card for after completing a well child checkup. So ever since birth all the way to age 18, children are entitled to a gift card either to Amazon, Safeway, or Target. And same goes for our prenatal members. After completing a trimester checkup, again, the gift card would be issued out to Safeway, Target, or Amazon rewards. The other benefits that we wanted to touch real quick on was the Medicare. Some of our members enlisted in Medicare and they receive Medicaid can receive benefits as far as transportation to and from their appointments. There's no mileage limit. If our individuals are receiving Medicaid and Medicare, they also have an allowance every 3 months of $250 for everything that is over the counter, which would include everything from vitamins, toothpaste, mouthwash, to protective safety gear to get in and out of the showers. Our website so you can reach out to us is www.chpw.org. Again, www.chpw.org. And a phone number to contact me is 509-944-0510. Again, that's 509-944-0510. I'd be happy to help you. And again, if you have any questions regarding the Greater Columbia region, I'm your source. Thank you.
Thank you, Blanche. And like she said, if you guys would like some more information on Community Health Plan of Washington, feel free to reach out to her, and I'm sure that she will connect you with the services that you need. Next, please help me welcome Alicyn Elder with Coordinated Care Health. Welcome, Alicyn.
Hi, thanks, Sandy. Like she said, I'm Alicyn Elder from Coordinated Care. Coordinated Care has 3 lines of insurance here in Washington State. We have managed care through Washington Apple Health, our Ambiter plan through the Marketplace, and our statewide foster care coverage. At Coordinated Care, we understand how important you and your family's healthcare needs are. It's important to us too. We are here to support your health needs and to make that part of your day, a whole lot easier. Did you know that a part of having a 24-hour nurse line, we also offer the ease to receive medical advice, a diagnosis, or a prescription by video or by phone. We have partnered with Teladoc, a convenient way for coordinated care members to obtain free telehealth services anytime and anywhere for non-emergency medical issues. Did you also know that you can also earn rewards through our My Health Plays program? If you complete a healthy activity, such as getting your annual comprehensive diabetes care, which consists of getting your A1C test, your kidney and retinopathy screening, you can earn $60 onto your Visa Rewards card that you can use to purchase a variety of products at Walmart, Amazon, or pay towards your utility bills, childcare, internet, and much more. At Coordinated Care, we are committed to providing our members with resources they need to ensure the best possible care. Please visit our website for more information at www.coordinated.com or give us a call. We would love to chat with you at 1-877-644-4613. Thank you.
Thank you, Alicyn. Thank you for sharing information on Coordinated Care Health. We now have Sara Irish representing MOLINA Healthcare. Please welcome Sara.
Like you said, I got to say already, I'm representing MOLINA, and at MOLINA we offer and provide services such as doctor visits, hospital care, ambulance, eye exams, dental services, lab and x-rays, medication, smoking cessation, and diabetes care, urgent and emergency care. We are offer virtual urgent care so our members can access from home by utilizing a phone, tablet, or computer at no cost. Virtual care can help with non-emergency conditions like cold, rashes, ear pain, sinusitis, flu symptoms. Do you have a phone? No phone? No problem. MOLINA supports SafeLink wireless free cell phone service for its members with 350 minutes and 1 gigabyte data to download so they can access My Health in Hand and My MOLINA. So they can find a doctor or clinic near to them, connect to virtual urgent care, to see their member ID and change their primary care provider and make payments to their QHP. Also be able to see their health information anytime and much more. We provide coverage in every region of Washington state, and that includes the Tri-Cities. Currently, we're promoting the open enrollment period, staying safe and healthy as we enter the cold and flu season during the COVID-19 pandemic. Some of our benefits consist in our preventive care incentives, child well checkups, motherhood matters, pregnancy program, Text for Baby, women's health, breast cancer screening, and prenatal care. Staying healthy with diabetes, which encourages our members to stay connected to their doctor and take charge of their health. As well, the behavioral health, which include mental health and substance use. To your primary care provider. We also offer 90 days paid Amazon Prime membership, health incentives to Amazon, gift cards, and our goal is to remove access barriers to healthy food and products. To learn more about our service, please follow up on our website, molinahealthcare.com. Thank you.
Thank you, Sara, for providing us some more information on MOLINA Healthcare. Please help me welcome Oscar Alvarado, representing Miramar Clinic. Welcome, Oscar.
Hi, so my name is Oscar Alvarado, and I represent Miramar Health Center with Yakima Valley Pharmaceutical Clinic. Our services include a team of medical providers, behavioral consultants, and registered dietitians that help our patients and their families learn ways to better manage their diabetes and chronic conditions. We also offer a chronic disease self-management program that provides free 6-week workshops for adults with any chronic conditions like diabetes. To date, we've helped hundreds of patients with their struggles with diabetes in the Tri-Cities area. We know that diabetic issues are a chronic problem in America, but it's even more pronounced in underserved populations. By approaching health problems from many different angles, we're able to provide more comprehensive solutions to our patients' health problems. Our clinic in Pasco is one of 3 Yakima Valley Pharmaceutical clinics, and we are eagerly awaiting the opening of a new clinic in Kennewick in May 2021. We are currently accepting new patients and would love for you to join us. Please visit our website at yvfoec.com for more information.
Thank you, Oscar, for providing that information. And like he mentioned, if you are in need of primary care, make sure you keep an eye out for their new building that will be opening in 2021. We now have Gabby Araico with Tri-Cities Community Health. Welcome, Gabby.
Hi, everybody. My name is Gabby Araico. I work in Tri-Cities Community Health. We are a federally qualified health center. We have clinics in Pasco, Kennewick, and Richland, and 2 school-based clinics in Pasco and Kennewick. We offer different services, including medical services. That will be pediatrician, OBGYN. We have urgent care. We also have vision, dental, urgent care. We have maternity support services, including WIC and First Steps program. And right now I'm talking about diabetes because this is Diabetes Awareness Month. We're in November. So talking about that, we offer the National Diabetes Prevention Program from the Center for Disease Control through the National Hispanic Alliance for Health. This was in Washington, D.C. They chose different sites to do this, and we were chosen in Tri-Cities. So what we do is enroll patients, all of them with risk for diabetes. Some of them we do a screening tool from the Center for Disease Control based on your age, your gender, your exercise, your high blood pressure, and of course your weight. And we also do the screening through an A1C, which is a blood sugar test that it's done to measure the average of your blood sugar of 3 months. So based on that, we enroll you in our classes. We have one-on-one in a group basis, but right now we're a little trying to figure out how we're going to work that out, and through online. We do it online as well. And we offer the gym with a certified fitness instructor, and we offer cooking classes. All this is for free right now. And we encourage the patient to change a lifestyle, and that's what it's all about, to stay healthy and prevent diabetes. Right now, we're also, it's becoming a success because we're trying to do that for our community. We offer them in English and Spanish. We have incentives for everybody. And right now we have a new program for the little ones. We're struggling also with blood sugar and fat, triglycerides, cholesterol in our little ones. So right now we have a program for the little ones that includes the exercise and healthy meal plans. So for any questions and things that we can do for you to deal with the diabetes and make healthy changes, call us. So it could be the 509-547-2204, or it could be my phone number. I'm very good with my phone number. It will be 543-1975, and I'm Gabby, and I can give you information and help you in any way. So take care of yourselves, and thank you so much to the Alliance to allow us to do this. Thank you.
Thank you, Gabby. Thank you so much for providing so many services for the entire family, not just the mom and the dad or the adult in the family, but children as well. Thank you so much for providing those services. Please help me welcome Nancy Crouppen, representing Trios. Welcome, Nancy.
Hi, thank you. I'm Nancy Crouppen, and I'm very happy to have this opportunity to tell you about our services. At Trios Health Diabetes and Nutrition Education, our dietitians and nurse provide education for people of all ages with type 1 and type 2 diabetes, as well as gestational diabetes that might occur during pregnancy. All you need is a referral from your doctor or healthcare provider. Most insurers provide excellent coverage for diabetes education. We also provide nutrition counseling for a variety of conditions if covered by insurance. Living with diabetes poses unique challenges, but it doesn't have to stop you from enjoying a full life or eating the foods you enjoy. Our goal is to help you understand your treatment options and play an active role in developing a management plan that works for you. Many people diagnosed with diabetes are able to continue living healthy, active lives. Our program is accredited by the American Diabetes Association, and we follow the national standards of care for diabetes. Research has shown that people who work with a diabetes educator tend to have better overall blood sugar control. If you are interested in wearing an insulin pump, our insulin pump trainers can help you choose the right pump for you and learn how to use it effectively. We also help our clients obtain continuous glucose monitors and learn how to make best use of the blood sugar data that they get from that equipment. We also have a diabetes educator in the hospital. If you are admitted to Trios and need help managing your blood sugars while in the hospital or have any questions about managing your diabetes, please ask to see the diabetes educator. Another unique service we offer is Camp Trios for kids with type 1 diabetes. This is a day camp in July that we hold every year. This year we held camp by Zoom, and it was still a great experience for our kids. If you know anyone or have children yourself with type 1 diabetes, please have them call our office and be put on the contact list for the 2021 camp. We are moving our offices later this month to the Southridge Care Campus next to the Trios Hospital in Kennewick, which is pictured behind me. Currently, we see clients on Tuesdays, Wednesdays, and Thursdays from 8:30 to 4:30. Please call us at 509-221-5442 for more information or access our website, which you will find at the end of this presentation. Thank you.
Thank you, Nancy. Don't forget to find them at their new location coming soon at the South Ridge location. And thank you for providing that camp to all those little ones during the summer, which is much needed to keep them active and motivated to continue to want to lead a healthy lifestyle. So thank you for sharing information on Trios today, Nancy. Well, I hope that you were all able to take note of all the various services that were mentioned from all of our community partners. And no worries if you missed anything, we will be providing you with direct links to their services. So yeah, if you guys would love more information, please feel free to reach out to every single representative, and I'm sure that they will be more than willing to better assist you. So this is it. I can't believe we just finished our first annual virtual event. So happy that we were all able to come together and provide all of you some more insight on how to better take care of yourselves, take some time to take care of yourselves, your loved ones, or your patients. On behalf of the Tri-Cities Diabetes Coalition, I would like to express our gratitude to everyone that took time to help make this a successful event. I would like to thank our coalition members and Dr. Person for always providing us with her guidance and support. Our keynote speaker, Karen Del Rio, all the way from El Paso, Texas. And in addition, I would like to personally express our gratitude on behalf of the Tri-Cities Diabetes Coalition to Yakima Valley Farm Workers Clinic on facilitating all the technical requirements in order to provide you with today's event. We hope we were all able to inspire you to take time to care for your patients, your loved ones, and especially yourself during this time of COVID-19. Thank you all for your attendance and your views.